This is Dr. Veera Sardana and I am at the Office of Health in India at Gurgaon. Health in India is one of the leading healthcare consultancy companies in India and has emerged as a leading medical tourism partner for large number of offshore patients traveling to India for getting quality treatment at low costs. Let us talk to Mr. Kuldeep Chaudhary, CEO of the company, and try to find out why so many patients choose Health in India as a preferred partner for their medical treatment in India. Good morning, Mr. Chaudhary.
Good morning, Dr. Veera.
Mr. Chaudhary, we have seen several reports in various media about a large number of patients choosing your company, Health in India, for getting treatment in India. Would you tell us the reason for so many patients choosing your company as a preferred partner for their treatment?
Veera, patients coming to India are actually looking for a quality treatment at low costs. Now, over a period of time, what has happened is as the healthcare in India has developed, the cost of treatment at the top end hospitals has been consistently going up. At around the same time, when Health in India started its operations, which was around April last year, we realized that the advantage that India enjoyed over several other countries like Bangkok and the South American countries is getting lost. So what Health in India decided to do was to identify the best doctors and the best hospitals, but at the same time also identify what should be the best cost of treatment. And we started offering the same costs which are available to the Indian patients to these international patients. Now, if you understand the international patient business which is being done by the hospitals in the country, most of the hospitals price their packages for international patients at almost 30 to 40% higher than what they charge from the Indian patients. Now, most of the intermediaries or the medical tourism companies that we can say, they bring in patients as these inflated packages. Now, in the bargain, what was happening was that India as a low cost destination was losing its advantage. Now, there are lots of other factors which can be attributed to the increased cost. There are lots of touts now there in the market who masquerade as patient facilitators. So on top of the hospital packages which are already inflated, these people add their margins and the final cost which is given to the patient is a very, very high cost. So Health in India decided to offer the costs which were the rock bottom prices given by the hospitals to these international patients.
Sir, as you mentioned that your company works in a completely different way as other companies work in. So don't you think that you're going against the stream and taking over the established conventions?
Yes, definitely. When we decided to adopt this method of charging a fee from the patients, I'll tell you most of the medical tourism companies, they don't charge any fee from the patient. Their services on the face of it are free for the patient. But since the packages that they are offering to the patients are almost 50% higher than the packages which Health in India offers, so Health in India charges everything on a very transparent basis. Our team members, they offer the best cost of treatment to the patient. Then all the other services which are like pick up at the airport, then transfer from the guest house, identification of the guest house, booking, all sorts of bookings, the visa facilitation, the currency exchange, everything that a patient might need when they are in India is being offered by our team, and for this we charge a very small fee which is just $250 per patient. Now let me give you an example. If a patient gets a package of say $8,000 from an medical tourism company, typically there would be a 25% margin which is being paid to that medical tourism company in the form of commission by the hospital is inbuilt. So basically the patient is actually paying a cost of around $2,000. Health in India offers them the base package which would be around $6,000 and would charge a fee of about $250. So yes, definitely we are going against the stream. I don't think there is any other company which is operating on this level, be it the companies established in India or outside. Virtually every company goes to a hospital, asks them about packages that they offer to international patients, Now, since most of the medical tourism business at the hospitals is also based on these medical tourism companies or the facilitators, or I call them touts, most of the translators and the interpreters who masquerade as patient facilitators. So the hospital international pricing is already high. So even if a patient tries to go directly to a hospital bypassing a medical tourism company, the patient would end up paying the same amount of money as they would have gone through a medical tourism facilitator. So here in Health in India has brought in a new paradigm to this business, where we tell them we'll find the best package for you where there are no hidden charges in it, and for our services they pay a very small fee.
So what do you think, what is the potential of medical tourism market in India, and what is the scope for Gurgaon to take a leading name in that?
See, looking at the bigger picture of India as a medical tourism destination, India has distinct advantages in terms of cost and in terms of quality. The government has been very supportive over the last couple of decades when duties on various medical equipments have been brought down consistently, and we have seen very very good quality hospitals coming up in almost all the metro towns. Now, in this process, Gurgaon has offered some more advantages in terms of bigger spaces to the top-end hospital chains. So you see big hospitals like Medanta, which is about a 1600 bed facility, Artemis, then Columbia Asia Max and Fortis is about to open up. And even the medium-sized hospitals like RV Hospital, which is about a 100-bedded hospital, they've all come up. They are offering great services in terms of the quality of the medical treatment and the patient care services. And most of all, the vicinity of the city to the international airport. Now, New Delhi airport is connected to virtually all parts of the world with direct flights. All this has made Gurgaon as the most favorable destination. Talking about the future of the medical tourism business in India, Health in India has been very strongly advocating to the various hospitals that they should do away with this dual kind of pricing, and they should actually charge for whatever services are being rendered. So if they are giving any extra facilities to the international patients, these services should be chargeable basis, rather than having an all-encompassing package which has no transparency in itself. So Health in India is trying its level best to talk to the various hospitals. We have succeeded. We have tied up with several hospitals who now charge the same amount from the international patient, and all the other services are outsourced to Health in India, for which we charge a very small amount. So all in all, I think this is going to be a multi-billion-dollar business, provided the Indian healthcare stakeholders they get their house in order.
And so what do you think, what do you advise your patients who are wanting to take a cheaper treatment in India? They're coming to India for a cheaper treatment. What would be your advice to them?
See, this is one notion which I would like to change. Yes, definitely India is one of the cheapest destination, but today India offers one of the best quality treatment. Indian doctors have always been renowned all over the world. Today the US President has, his medical team consists of several Indian doctors. The NHS in the UK has a large number of Indian doctors serving over there. India has always been very, very strong in terms of academics. Then Indian nurses have been exported to all parts of the world. So all in all, the fundamentals of Indian healthcare are pretty strong. The world should not look at India as a cheaper destination. But yes, from an individual patient's perspective, I would tell them to always look for the best doctor, the best hospital and the best cost. Now these are the three parameters which the patients need to take into account, and then take a decision about coming to India. Of course, in the entire process, because you're going to a foreign land and there would be lots of things where you would need help. So having a patient, a medical tourism company does help. It helps immensely. They should look at the testimonials of the patients who have got treatment in the country. They should also look at the testimonials of the doctors, how many procedures a particular doctor has come, because we see lots of wrong things happening around where patients are taken for a ride just because they were not fully informed. So my first advice to all the patients who have decided or who are just making up their mind of getting treatment in India is to take an informed decision. And of course, today net is available, net has its reach far and wide, so they should use net extensively to search for all these things.
Thank you so much, Mr. Chaudhary, for all your insights you've
Thank
given
you.
on healthcare. So we have seen how Health in India is transforming the medical tourism market in India and also creating a goodwill for the country in the international arena. We wish them well in their endeavour. This is Dr. Veera Sardana with cameraman Sanjit Bhattacharya from the Office of Health in India, Gurgaon, Haryana, India.